No doubt medical professionals are busy during this pandemic, and it's not just COVID-19 they're dealing with. Here's Monica de Anda.
Cancer patients are being treated daily here at Harlingen Medical Center, and preventative measures continue to make sure those battling cancer are safe during this pandemic.
97.8.
The screening process for possible coronavirus symptoms starts before you're allowed to set foot inside the hospital.
Fever, runny nose, sore throat, coughing.
Oh.
Have you traveled outside the valley within the past 14 days?
No, I have not.
Oh, okay.
Patients, doctors, nurses, and other essential staff
Just go ahead and place it right there. All right, thank you.
all go through this process daily. And for many cancer patients being treated here, concerns about coronavirus are top of mind.
But in general, our cancer patients are more susceptible to infection, so we advise them to be very cautious about infection.
Todd Schenkenberg is a medical cancer specialist at Harlingen Medical Center. He says with what they know right now about COVID-19, it doesn't appear that patients battling cancer would be more susceptible to the virus. But because their immune system is typically weaker,
Patients whose immune system is compromised, whether it's from their illness or chemotherapy, should take more precautions. Hand washing, wear a mask, shelter in at home. If they follow those precautions, they'll be safe.
Schenkenberg says in addition to following CDC guidelines, cancer patients and their families should practice social distancing and stay home as much as possible. He also says patients who are going through or are about to start treatment like chemotherapy or radiation are looked at case by case.
I think it depends on the treatment. If it's something as simple as a hormone pill, then that doesn't affect your immune system. But if they're on, say, intravenous chemotherapy, we may have to stop it.
While patients in remission,
It depends on the kind of cancer it is. Many cancers, if you're in remission, your immunity is the same as anybody else's if you're not on active treatment. Some cancers, by their nature, put you at more risk for infection.
surgeries, biopsies, and checkups for patients are also being handled individually.
For example, I had a patient last week that's a long-term cancer survivor that has an abnormal mammogram. And I told her, and I told the hospital I felt she needed a breast biopsy, that she should not wait 2 or 3 months to have that done, and the hospital was very accommodating.
Schenkenberg says ultimately communication with your oncologist is key. Monica de Anda, Channel 5 News at 6.